past 3 years have been quite a journey. Sometimes it feels like it was just yesterday since my first day of physical therapy school, and other times it feels like it has been an eternity. Reflecting on the past 3 years of graduate school, I have realized just how much I have learned and how many opportunities and programs I had a chance to be involved with. I think back to the first year in Growth Anatomy Lab where I had the chance to dissect with PA and OT students. I recall many great memories from participating in the PT Olympics, Interview Day, MS Swim, Goodwin Exercise Group, the Student Outreach Clinic, Butler Adapted Football Camp, and the list goes on. I believe that my 3 years in the IU DPT program has prepared me to become an emerging leader in the field of physical therapy. One way in which I see myself as an emerging leader is being a physical therapist who incorporates evidence-based practice into my daily routine to guide my examinations and interventions. The IU DPT program did a great job of driving home the concept and importance of evidence-based practice. This was incorporated into not only 2 distinct evidence-based research courses, but was also integrated into nearly every course in the program to at least some degree. We discussed sensitivity and specificity of special tests, clinical practice guidelines, and clinical prediction rules. I was also able to learn more about clinical prediction rules and put them into practice during my clinical rotation at Community Health Network Physical Therapy and Rehab, Carmel. My CI was a great example and did a great job of incorporating evidence-based methods into her practice. I think these experiences have adequately prepared me to think critically about assessment and intervention techniques, and to not just do something to do it or because it is the way it has always been done. In order for me to achieve this goal of being an evidence-based practicing physical therapist, I think that I will have to wisely select the continuing education courses that I attend. I need to ensure they are relevant to my practice setting and will improve my ability to effectively treat my patient caseload using the latest evidence. I also need to be diligent about staying current in the literature after graduation. I have had multiple therapists tell me how hard it has been for them to stay up to date on current literature due to time constraints once they graduated and started working full-time as a therapist. I will have to dedicate block time for myself into my busy life schedule to allow time to adequately sift through current literature and evidence. Another way in which I see myself as an emerging leader is by being a physical therapist who consistently screens vitals and performs skin checks. Again, the IU DPT program did an exceptional job in this area of education. We were repeatedly encouraged to screen vitals on every patient and to always perform skin checks on patients with diabetes or peripheral neuropathy. It surprised me when I was out on my clinical rotations how rarely vitals were assessed and how rarely skin checks were performed by physical therapists. I am thankful that the IU DPT program taught us to challenge the status quo and to be agents of change. I think that it will be imperative for me to remember that just because it is not common practice, that it does not make it the right thing to do. In order for me to achieve this goal, I will have to lead by example in the clinical setting. It would not surprise me if I were questioned by other therapists why I assess vitals or inspect skin so frequently, so I will need to be ready with an educational explanation. If I am prepared in my response, I think it will increase the likelihood of the questioning therapist to adopt my method of practice. I believe that I can also become an emerging leader by consistently incorporating functional outcome measures into my daily practice. Based only on what I have seen in my clinical rotations, I think that the physical therapy profession could do a better job of this. Incorporating standardized functional outcome measures more consistently would allow for easier comparison and outcomes between patient diagnoses and between therapist effectiveness. I believe that I was introduced to a wide variety of functional outcome measures both in the classroom and on my clinical rotations, which will allow me to implement them into my practice when I graduate. In order for me to consistently and effectively incorporate functional outcome measures into my practice, I will have to research the most evidence-based and relevant ones to the setting I am practicing in. And similar to a point I made earlier, I will have to lead by example in the clinic and encourage other therapists to join me. Being an advocate of preventative physical therapy would be another way for me to become an emerging leader in the field. At this point, physical therapy and the greater healthcare system is focused on treating disabilities and injuries, but not necessarily preventing them. One of the patients from my clinical rotation at Community Health Network Physical Therapy and Rehab, Fishers, really made me think about this concept. They asked me if there was a way for them to continue to work with physical therapy down the road to prevent further injuries, even if they were not currently in pain or injured. Unfortunately, my answer was no, but that is a great idea. I'm not exactly sure how this would look, or if it'd even be realistic to get insurance on board with the idea, but preventative physical therapy is definitely something I would like to help put on the radar. Like I mentioned, this is an ambitious goal and will not be easy to achieve. I think one of the most relevant ways for me to introduce the idea is to be actively involved with the legislative side of physical therapy. Another possibility would be a self-pay or cash pay program to eliminate the insurance side of things. Next, I plan to be a leader by promoting and advocating for the physical therapy profession. My experiences at McCordville Elementary and Goodwin Exercise Group helped me to realize 1. How little some people know about the physical therapy profession, and 2. How much of a help I could be to people by simply introducing them to and educating them on some basic concepts. When I begin practicing as a physical therapist, I would like to seek out opportunities to connect with the local community and promote the physical therapy profession. To achieve this goal, I think it will be as simple as being proactive in my search and jumping on board with volunteer opportunities to reach the local community as they arise. I will have to be diligent about always making time to reach and educate others outside of my normal work hours. Lastly, I see myself as becoming an emerging leader in the profession of physical therapy by promoting physical therapists to treat all parts of the body. I have seen it in the clinical setting over and over, where occupational therapy treats the upper body and physical therapy treats the lower body. The IUDPT program as a whole did a great job of encouraging us to treat the entire body, especially Dr. Miller. She would enter courses with some pearls of wisdom, and one of them would be to make sure we always treat the upper extremity. I would like to encourage other physical therapists to not shy away from treating the upper extremities, as we are qualified and competent to do so. To achieve this goal, I will have to again lead by example. If other physical therapists see me taking initiative to treat the upper extremities, I believe this will allow for a window of opportunity. Granted, I know that it may not be this simple, as sometimes it almost feels territorial in the clinical setting between OTs and PTs when it comes to upper versus lower extremities. To manage this aspect, I think that communication and collaboration will go a long way. It will take getting to know my colleagues and professionals working alongside me, but above all, it will always be imperative that the best interest of the patient comes first.